Well, it's refreshing, isn't it, that someone can make an admission and say, look, we've got it wrong, or at least we've delayed in our action, or we could have anticipated better. But quite frankly, this is an issue that's been ongoing for some time, some considerable time. Many people in the community have approached all of the MPs in the opposition. Indeed, I approached the Minister for Health back in May to highlight a number of these difficulties. I was not satisfied then with his response as to the lack of face-to-face appointments that people are not getting with their GPs. And we filed a question back in May. It's only until July that we get an answer from the Minister, who continued to answer the point that there could be face-to-face time with doctors if so required and if so requested by the patient. Mm-hmm. It's simply just not good enough, quite frankly. This could have been anticipated months ago. And for the medical director to say now, certainly for the government to say now, that they have pulled the 20 people that were deployed to the GHA in the middle of July, when in fact what the minister had said quite publicly to Parliament was that telephone consultations will continue post-COVID, is just not acceptable. Clearly, they should have anticipated better, they should have planned better, but look, that is a complaint. Let's move forward. Moving forward is to get a plan for the delivery of healthcare into the future.
That's something you're calling for. But you also admit the nature of the pandemic and its impact, it's fast, it's ever-changing. Realistically, how much can we forward plan? You do call the government to publish a roadmap for how health services will be run after the 1st of September.
Well,
how
look,
realistic is that?
The Unlock programme, for instance, is now dated. And what the government should have done is present a plan for the next few months to assure members of our community that they can access medical care, that they can access their prescriptions on time and within a space. And look, we appreciate this is a very fluid, a very dynamic situation. It changes almost daily, weekly at the moment, insofar as the position in Spain is concerned. But look, we need to have a plan to make sure that people can access the health service. You know, things don't just, it's been a pressure point on our health service, the COVID pandemic. But people still have their ailments. People still have their concerns about their own health. And they should be able to access healthcare, possibly modified to what we had pre-COVID. But for the government to say to people quite publicly in Parliament that telephone consultations are here to stay post-COVID, I think is irresponsible. I think we need to try to say to people that we will do our best to try to get face-to-face time when it is safe to do so. But there is no plan, and the government haven't presented one.
Now, we could be stuck in this middle ground for quite a while still. What would you propose to better manage a situation with no end date in sight? Well,
the prescription service, for example, that has been a bone of contention for many people that have been approaching me now for many months on how we can get the system going. Now, I know in other countries there's a chip and pin system with a health card that allows you to go to the pharmacy in which your prescription, you'll be notified of when you need to top up your prescriptions. Now, why can't we have a system that is linked to our technology in the modern world that we have, so that people can simply pick up prescriptions when they are due, rather than having this old-fashioned prescription repeat system, which doesn't really work and is not fit for purpose. And COVID has presented us with an ideal opportunity to modify our prescription process. And that was one simple change that can make a huge difference to people receiving medication in that way.